member of the NAACP, Ms. Kenesha Jackson.
Thank you for that introduction. Good evening, everyone. On behalf of the Maricopa County Branch NAACP, welcome to another From the Circle to the Cypher community conversation. For those who may not be familiar with our Circle to the Cypher concept, this phrase was coined by Political Committee Action Chair, Dr. Camilla Westingberg. Tonight's community conversation will highlight one of the 6 NAACP game changers, health. Founded in 1909, the NAACP is the nation's oldest and largest nonpartisan organization, and our members are the premier advocates for civil rights in communities across this country, including right here in the state of Arizona. As we move closer to the general election, our community is in the midst of making a variety of decisions related to their health, especially in the era of COVID-19 pandemic, where health care disparities that have existed for a number of years are now at the forefront. When it comes to the healthcare system, our healthcare professionals, administrators, policy experts, and more are some of the key persons involved in just this whole process. Again, the COVID-19 pandemic has really showed us the disparities that have existed. And tonight we are happy to have community advocates, Judy Greene and Tamera Massad, to join us on this event. In tonight's conversation, we'll dive into key topics to see where they stand on the important issues of healthcare. So I am delighted to introduce now to you Rocky Tirade, who will serve as tonight's MC. Thanks again for joining us again, as he has been the MC for all of our From the Circle to Cypher events. Welcome, Rocky.
Thank you, Kenesha. So for that warm introduction yet again, as you can see, I'm clearly honored to serve as the MC tonight yet again. Wow, this has really been an amazing experience. So over the last several weeks, the Circle to the Cypher community conversations have allowed us to engage directly with community leaders, get out the vote, and stay informed about issues like health that disproportionately impact Black and Brown communities. So it's important for us to continue the conversation and discuss the future of public health with our community leaders and experts. So during this discussion, attendees will be able to enter questions in the chat section, where selected questions will be presented during the audience Q&A section later on. So thank you to all of our guests for taking the time to attend tonight's event. But now it's my pleasure to introduce our moderator, Brielle Reese, who's a superhero for the record. A native of Maricopa County and community leader, Brielle Reese is guided by creating places of equity and inclusion for people of color all over the Valley. Eager to learn about the cultures and communities of a Democratic voting state, Brielle actually attended the University of Southern California, where she received a Bachelor of Arts in Public Relations. So upon moving back to Phoenix, Brielle had prioritized getting people of color elected while defending the rights of marginalized communities across the state. Understanding what is at stake in every election, she's led critical campaigns for voting rights and equitable education. Her passions for women's rights led her to become an organizer and leader of the Women's March in Phoenix, where she recently led hundreds of women in solidarity march with millions of others around the nation simultaneously to vote in new leadership. So it was a major event. Brielle currently serves as the diversity director for the Young Democrats of Arizona, Maricopa County, the Maricopa County Young Democrats Outreach Coordinator, Executive Committee of the NAACP West Valley Director of Communications for Practice Justice, and is employed by the Maricopa County Democratic Party as a field organizer. So please help me welcome Brielle Reese.
Okay, I was muted, but thank you so much, Rocky. I am honored to serve as tonight's moderator. We will discuss issues related to public health and policy with community advocates, Dr. Judy Greene and Tamera Massad. From COVID-19 pandemic to healthcare inequities that exist in Black and Brown communities, we will discuss tonight the importance of improving the quality of care and access to services.
With that said, please welcome panelists Dr. Judy Greene and Tamera Massad.
Good evening.
Good evening.
Good evening.
Good evening, Dr. Greene. Good evening, Tamera. Thank you for agreeing to participate in tonight's Circle to Cypher event. We're happy to have you in attendance, and tonight we will start with the discussion with questions on key topics related to public health that impact the greater Phoenix community. We will end the discussion with questions from the virtual audience, and a member of the Maricopa County Branch NAACP will be monitoring all the questions as they come in. So feel free to join us in the chat box. Those of you watching, please enter the questions as they come to you so that you don't forget. Okay, let's get started. Dr. Greene and Tamera, I'd love both of you to take a minute and introduce yourself. Tell us who you are, describe your role in public health, and why you're a healthcare advocate. Dr. Greene, let's start with you.
Okay, I would like to first thank the NAACP for inviting me to speak on such an important topic. I am a lifetime member of the NAACP, and I remember when I was growing up, we used to, my father used to host the NAACP meetings in our home. So I go back a long way with this organization. I am a proud HBCU graduate, and I have practiced diagnostic radiology for the last 36 years. For the last 10 years of that, I practiced here in West Side of Phoenix, and my specialty is breast imaging. I've seen medicine practice pre and post the Affordable Care Act, and I know, what it's like for women to not have health insurance. It's really a shame for, considering the size of this country and the resources available, that we still have so many uninsured people. I've seen women come in with breast masses, untreated, and it was eroding through the skin with ulcerations, or it's burrowing deep into her chest wall with erosion of her ribs and sternum. And it's just a shame that this happens in this country. We're much better than this, and people should be provided healthcare as a right. It's not a privilege, it should be a right.
That's amazing. 36 years is so long and so important that you're, after 36 years, still giving back. There are so many people who would become disgruntled at seeing such inequities. But the idea that you're here giving back and sharing the education and the knowledge and the resources with us is something that we're extremely appreciative of. Okay, Tamera.
Yeah, thank you for that. And I just also want to say thank you to the NAACP and Kenesha for this opportunity to speak out on these issues as well. I am a healthcare advocate, lifelong as well, maybe not as 36 years, I just turned 35. I'm originally from Oklahoma, and like Kenesha mentioned, I am the Domestic and Sexual Violence Prevention Manager at ADHS, but I go back from Oklahoma and started out as a crisis line volunteer in high school, and recognized the inequities from a long time ago, from who was calling and seeking out help from a long time ago as a kid, and realized then who was not calling, getting help. And when I was, in college as well, still volunteering and seeing who was getting services for different types of trauma. And I used to work with folks from the disabled community, from visually impaired and blind. And everywhere that I have gone in trying to help others in different capacities, the one trend that I have always noticed is that Black and brown voices and bodies have been left out. And that's all the way from domestic and sexual violence to the disabled communities, to folks who are in trauma, seeking suicide prevention and needing help. It's always brown and Black voices and bodies who are being left out. And that's the common trend that I've noticed in my career as an advocate in various capacities. So we need to be included. So whatever capacity that I can help, and that's what I want to do, and be an advocate. So that's what I try to do.
Wow. I mean, you both said something so powerful. I think what ties both of your experiences together, whether it's Tamera, you starting in high school, or Dr. Greene, you seeing women just with actual physical ailments, right? One is more of a mental situation, and the other one, we look at physical situations that women don't have control over. But both of them are inequities that exist mostly in Black and Brown communities. So let's start the conversation by unpacking what that really means, what these inequities actually are, right? So addressing disparities in health and healthcare are important not only from an equity standpoint, but also for improving health more broadly by achieving improvements in overall quality of care. What are the current challenges to addressing these disparities? Judy, let's start with you.
Okay. Well, I believe currently, and we have been in a public health crisis among Black and Brown people for years. This is nothing new. The main cause of this health crisis, I believe, is systemic racism. I mean, let's call it like it is. You know, Black people have not been afforded the opportunities that other people have. We don't get the top high-paying jobs. We don't get the educational opportunities. We're not afforded the privilege of those luxuries so that we can be able to work remotely. And all of that affects our health in the long term. We work these lower wage jobs. You can't even get a living wage here in Arizona. So we're not getting good health insurance, if we have health insurance at all. You have, as a result of that, multi-generational households where a lot of essential workers that are at risk are living together. So it's impossible. If one person gets coronavirus, you can't possibly quarantine under those circumstances. A lot of these workers aren't afforded adequate PPEs. I've even had physicians say that they can't get the 95 masks. So, if physicians can't get adequate PPEs, what do you expect with the healthcare workers? They're also working together in crowded conditions. Look at the crisis with the meatpacking industry. And a lot of the people in the managerial positions don't take it seriously. So they don't help these people to isolate them or give them safe and secure work environments. Also, these people are, if you don't have money, you have to take public transportation. So that's another risk. So our essential workers, of which 21% are Black people, they're assuming a lot of the risk, but very, very minimal benefit for what they do. I think, they're underappreciated. And as a result of this, it's the institutional racism is affecting Black people of color very adversely.
That's amazing. I think to be able to understand what it looks like to not just call something inequities, but to hit it on the head and say this is institutional racism, to be able to call it out for what it is makes it so much more powerful, because when we call it by its name, we can address it and start to figure out how to fix it. Judy, that was really awesome. Tamera, what do you think?
Absolutely. Excuse me. I completely agree. And until we address it at the level of which we fund these things, right? We can address it all day long in the community. But until we as a community come together and we hold those that we elect accountable, we're not going to have any real change. And until we figure out how, as a community, we hold people accountable, right? How do we have these conversations in meaningful ways, right? Because we keep voting in the same people, and we shame on me if you fool me once, right? But how do we have meaningful conversation and meaningful change We can throw around buzzwords all day long, right? But those buzzwords fall on deaf ears if we're not talking about the real change that's affecting people. And if we're talking in silos about things that don't really matter, then we're not talking about real change that's affecting the real people. And if we're going to talk about the things that that's affecting survivors of domestic and sexual violence and COVID, then let's talk about the things that's affecting the intergenerational trauma of all of it, right? That's how we talk about the change, because these things are not in silos. You have to address the whole person, right? Because COVID isn't affecting silos. COVID doesn't care about silos. And COVID does not care about the person that you elected 2 cycles ago. COVID is right now. That's what matters, because the election is in 2 weeks. That's what matters. And until we start talking about all these things in a community forum, in a way that brings together our communities, that's what matters. That's what brings about real change, not these siloed conversations, pitting people against others. That's old stuff. That's part of the old game plan that doesn't work. That's old news.
That's so good. I absolutely agree, Tamera. I think when you're talking about pitting people against each other, now we're actually taking some time to address not just the issue, but how do we fix it, right? What are the steps to address these issues? And you talked about something really powerful, like voting, right? Let's talk about what Dr. Greene said when she talks about what the problems really are. The fact that we are working from home and we can't work from home because of our childcare or our financial situations. The idea that as African Americans, as Black women, we don't have the proper living wages. We don't have the appropriate time to make sure that we can figure out how to funnel COVID, how to funnel our families, how to funnel the workforce, and do it all together while we're still taking public transportation. And she said something really powerful when you said, Dr. Greene, we have high risk and minimal benefit. When we discuss all of those things, what do you think, Dr. Greene, are some steps to finally addressing these issues? Now that you've just called them out and said what they are, Tamera said we have to vote new people in. What are your suggestions on how do we fix some of the issues that you've discussed?
Okay, first, well, let's look at the pre-existing conditions that we have. We have high rates of obesity, and that leads to diabetes. 40% of Black males, 60% of Black women are obese. A lot of that is related to diets. You know, unfortunately, we live a lot of lower income people live in food deserts, so we don't have access to the large stores that carry the fresh produce. Because of lower incomes, a lot of us can't afford to buy the fresh produce. You know, it's a lot cheaper to go to Burger King and get 2 burgers for $5 than it is to take the bus or if you have a car, to drive to a store and buy some fresh groceries. So all that contributes to obesity. If you're working 2 and 3 jobs or 2 part-time jobs, you don't have time to go out to go to a health club. You can't afford a health club. And we found out what happened with Ahmaud Arbery. You know, heaven forbid if you try to walk or jog when you're Black. So you know, what kind of recourse do people have? But we do need to look at our risk of obesity and subsequent risk of diabetes, because we've got to get that under control. Also, as a result of environmental racism, we live in areas that have very poor air quality, and that's going to increase our risk for asthma. In researching this subject, I found out Black children die 10 times higher than white children. I mean, that is a bit abysmal. You know, there is a hereditary component to asthma, but when you put air pollution together with that, and these horrible toxic environments that we're exposed to, you know, you have all kind of respiratory issues. We also have higher rates of heart disease related to diet and just the general stressors that are associated with being a Black person in America. You know, we have that causes hypertension. Also cancer. Our cancer rates are high because, you know, especially I can speak about breast cancer. You know, Black women die at a 22% higher rate than white women because of breast cancer. And a lot of that is lack of access to healthcare. We don't have the screening available. A lot of women don't have time to go to the screening. Who could take off during the day and get your mammogram if you're working? You know, if you don't have sick leave or you don't have any type of flex plan, especially in Arizona. This is one of these right to work states. So, you know, it's tough if you're working here. So those are some of the issues. There are also what they would call collateral deaths, which are related to just neglecting yourself. And that the coronavirus has really brought that out because people are afraid to go to the emergency rooms. They're waiting until the last minute till they get care. And our testing in this city I can speak to has been abysmal. You know, how many times have Black people tried to go to the emergency room or to the clinic and tried to get a test and were denied it? And then they don't go until it's too late. And when you have a poor outcome with coronavirus, it can happen very fast. So people are subsequently found in their homes dead because they're afraid to get turned away again at these testing centers. So those are some of the issues that we really need to deal with.
Wow, you gave us so much to unpack, right? Taking what both of you said, what Dr. Greene just said, what Tamera just said, and we're talking about diets and food deserts, we're talking about voting. When we really look as a Black community at what needs to be done from a progressive standpoint, how do we fix these problems? Tamera hit it on the nose. And Dr. Greene gave us exactly why we have to vote. When we talk about food deserts, we mean city council. When we are talking about no time to go to the gym and public transportation, environmental racism, that's the Corporation Commission. That's the Board of Supervisors. Right to work, what Dr. Greene was talking about, that's the state legislator. Testing, that's the mayor and the Board of Supervisors. The importance of not just voting for the president, but voting all the way down the ballot in the Black and brown community is just communicated from both of these amazing individuals at two different levels. They gave us not.
I'm sorry, and may I add, and to tie in something really quick, there's not one culturally specific organization in the state of Arizona for Black women to go for domestic or sexual violence services. Not one in the state. So that's also a local issue in this state. Why? Why is there not an agency or an organization here that services culturally specific service that has culturally specific services for Black women?
Yeah.
There's not a rape crisis center that serves Black women, let alone women in general, but a culturally specific service center here, family justice center, family advocacy center, whatever you want to call it, for Black women. That is a state and local issue as well. Yeah. So if we want to talk about a federal issue or what can be done with federal funds, local funds, state funds, or anything like that, talk about food deserts, there's a service desert, a literal service desert, okay? So that's also something that needs to be addressed.
Yeah. There's only a few candidates that I've heard talk about that. And obviously, and the NAACP, we're not telling you to vote for. So I've heard just a few candidates talk about that, a few for Senate, some for county attorney, and a few running in this House of Representatives. But only a few have really advocated on our behalf in those situations. And so, like we talk about, it's really important to do your research on your candidates and vote up and down the ballot, because these things can be changed with simple legislations. So let's talk about, as Black women, right, working in the healthcare industry, how has your own experiences influenced the daily work in your respective area when it comes to healthcare? Tamera, let's start with you.
Well, I have my own challenges, personal challenges. As a professional, personally speaking, I would love to see more more faces that look like mine. I would love to see more Black and brown faces, more advocates, because without more advocates and folks that look like us, how in the world are we going to be able to tell our own narrative? Because a survivor story is their own story. There is not a one size fits all story of a narrative of a survivor's story and survivor's experience. Plain and simple. And if anybody says otherwise, they have no idea what they're talking about. Just like there's not a one size fits all solution to any problem. And if anybody tells you otherwise, they have no idea what they're talking about. I'm sorry to say. And so the field needs more brown and Black advocates, more brown and Black professionals. We need more brown and Black folks in leadership positions. We need more brown and Black folks on boards of directors. We need more brown and Black faces making decisions. That's what we need. And we need more brown and Black folks who are mentors, right, who can come out and say, hey, we need people to go back out into the community. Yeah. So we can build the community. That's what we need. We need folks to build the movement, because guess what? The movement was built by us and then kind of co-opted by the other movements. And so let's co-opt it back, you know?
I love it. I love it. I think that is what we're doing here. This is the first step with what we're taking right now in this exact situation, is finding mentorship, making sure that we're giving back and taking the experiences and the resources we have and pouring back in to our community, within our community. Dr. Greene, how about you?
Just to piggyback on what Tamera said, we only have 5% of physicians that are Black. There are Black people are 13% in this country, but we have 5% Black physicians. And Black physicians would tend to work in Black areas. We would tend to listen, I think, to the patient, spend more time, because there's a relatable quality. If you're with a physician that looks like you, you're gonna probably be tempted to talk open up a little bit more about what's bothering you, and the conversation would go more both ways. Just as an example to that, someone looked at women who had mastectomies, Black women who had mastectomies. Well, there's a law in the books that say if you have a mastectomy legally, the insurance company cannot deny you the right to have reconstructive surgery. But someone looked at this in Black women, and 20% of the Black women who had mastectomies did not know about that law and were not offered reconstruction. So, that should not happen. I think if we had more Black breast cancer physicians, more breast surgeons, more Black internists, more Black physicians, period, those kind of things wouldn't happen. Someone like Serena Williams almost dying during childbirth. Why do Black women die 3 times the rate of white women in childbirth? Black infant mortality is twice that of white women. Come on, this is the United States. It's a developed country. That should not happen. One thing that we need to participate in more screening screening examinations. We need to get screened for prostate cancer. We need to get screened for breast cancer. We need to get screened for heart disease and diabetes. You know, come in and see your physician. I mean, I was thinking about these past presidents. They live into their 90s easily. Why is that? Because they have excellent health care. They have screening exams. We also need to support some of these Black cancer organizations. We do have the what's called the CBBC, the Coalition for Blacks Against Breast Cancer. It's a Black women's group. It consists of both breast cancer survivors and supporters. There's also beginning to form a Black men's prostate cancer group. So, you know, if you have diagnosed cancer, join these support groups. It helps because, you know, a lot of the women, you know, take each other to their doctor's office if they're sick. You know, there's a mental component to illness too. When you feel good about yourself, or when you know you have a support system, you're going to take care of yourself, and you have that extra safety net. Also participate in a lot of these research studies. I know we've been jaundiced or biased because of the Tuskegee study, but you know, especially with breast cancer, you know, Black women have breast cancer at much higher rates when they're under 40. You know, it's a very aggressive form of cancer that younger Black women get. But unless you participate in these studies, we don't know how to treat it. Like Tamera said, you know, it's not a one size fits all. You know, cancer treatment is tending to be more and more specialized. So participate in these clinical trials so that they'll know how to treat Black people when that kind of thing happens.
I love that. I mean, Breast Cancer Awareness Month is this month in October. So while breast cancer affects women of all ethnicities, it's unfortunately now more fatal, as you just talked about, Dr. Greene, for Black women. So when we talk about what communities can do to improve breast cancer awareness and access to services, I think you gave us a lot of really amazing resources just now. Do you have any specific, maybe one more resource that we can tap into that we're not doing? My favorite part about what you just spoke about, something I was not aware of, was the high risk of women under 40 and how much it affects our bodies specifically, and the rapid rate at which it grows. Maybe another nugget like that, since it is Breast Cancer Awareness Month, what can we do as a community to know more about how to get screened?
Well, you can always talk to your primary care physician. And if you don't have symptoms, you can set up your own screening examination. You don't need a doctor's referral. You just give that mammographic facility the name of your referring physician. So you do not have to, if you're 45 and over and asymptomatic. So, you know, and look at your family history. You know, we have a tendency to not talk about issues like that. Find out, you know, do you have a family history of diabetes? Do you have a family history of heart disease? Do you have a family history of breast cancer? Because they're finding a lot of these clusters. I had a friend that her mother died of breast cancer, her sister died of breast cancer, her other sister had breast cancer, and there is a hereditary form of breast cancer. So, you know, I asked her, well, have you been screened for the BRCA1 gene? She hadn't been screened. But, you know, unless you talk to your physicians, talk to your family, you know, tell your story. And don't be so quiet about it when you have family reunions. Try to probe about, you know, what's your family history.
That's good. That's really good. I know I, for one, have been completely guilty of not really probing, just like you said, in the Black community. So often, those aren't the conversations that we want to have. But taking back what we just learned in this conversation, I'll be sure that at my next family function, which is probably Thanksgiving, right, I'm going to ask those questions. So thank you for the suggestion. Now, Tamera, the next question is specifically for you. Now, when we look at October, not only is it Breast Cancer Awareness Month, but it's also Domestic Violence Awareness Month. So public health is placing a greater emphasis on dismantling and implementing effective violence prevention programs and policies. What does that implementation look like here in Arizona, and how can we be a part of it? What can we do to make it happen faster or to change the way that it's structured?
So what we can do right now for Domestic Violence Awareness Month is right now just maintain, be aware of what's going on around COVID right now, just maintaining awareness around COVID precautions, keeping that in the forefront, and making sure that survivors have safety or can get to safety, and staying aware of safe spaces, and having a safe space and can get to a safe space, and knowing the number for the National Domestic Violence Hotline, and can have access to that information, I would say, would probably be one, or accessing information to the Arizona Coalition to End Sexual and Domestic Violence, I would say, for sure. I didn't know if you want something more specific.
No, I think that was extremely specific, and it gave us something detailed and pinpointed that we can take home with us, which is exactly what I was asking for. Thank you so much for those detailed responses. So when we talk about everything that we've just discussed for Black women, I think we've really covered what it looks like to be a Black woman on the other side of healthcare, actually getting the treatment, and how important it is to make sure our voices are heard, how important it is to ask the right questions, to vote in legislation and lawmakers and policymakers that will stand on the right side of history and fight for us as Black women and Black men and Black and brown communities, so that we can have adequate healthcare, but also mental health care, right? Because when we think of healthcare, so often we just think about the physical. So now that we've asked you a few questions, let's go ahead and take some questions from our guests. Rocky, let's take the first question from our audience.
Okay. So the first question from the audience would be, what advice do you have for Black and brown folks when dealing with healthcare and the reality that healthcare shortchanges Black and brown patients?
I guess that would be for me. Like I said earlier, I think, we need more Black people in medicine, more Black physicians. Plus, when you go to see a physician, take someone with you as your advocate, because when you're sitting there talking to your physician, you probably remember about 20% of what they say. So bring a friend with you and have them write down what the physician has said to you. A lot of times, you walk out that door and you don't remember what the particulars of the conversation. Also, before you go in, make a plan. Just like voting, we say make a plan to vote. Well, make a plan to see your physician. Write down some important questions, because you get in there and you're nervous and you're getting a lot of information, a lot of words are probably said that you don't understand. Write down your questions. Do your research before going there, so you're dealing with facts and figures.
That's great. That's great. What about you? What do you think, Tamera?
Absolutely. I mean, the same thing. I mean, anytime if you are a victim experiencing trauma, the same thing. If you are going into a situation, you're not, your thoughts aren't going to be in a linear sequence. So jot down, if you can, what you remember, what you're thinking when you can, what you're sensing, what you smell, think what you can remember to help you remember if something triggers you, right? And then that will help you along the way. But if you cannot remember everything in a linear sequence, that's fine. That does not mean you are a liar if you can't put together all the thoughts in a questioning, you know, if a law enforcement officer is questioning you, or if you are being asked all these questions in an intake process when you're going to a shelter, that's okay. That's okay. As long as you are in a safe space and away from harm, that is the goal. And that is okay. That's all you are free from the danger, and your children, your child is safe. That's okay. And that's all you need to worry about.
Okay, I love it. Next question is, as we are now in a general election season, as you know, the disenfranchisement for all Black voters continues to be a common roadblock. How do we fight voter suppression and the fundamental right to cast our ballot?
You vote. That's what you do. You vote. You make sure your address is up to date. You make sure you have your photo ID if that's what you have to have. You make sure you have that provisional ballot if that's what you got to have. You make sure you go down and you vote. That's what you do. If that's what you have to have, that's what you do.
And another thing I would add to track your ballot. And that's one thing that we have in Arizona, that ballot tracking software. It's amazing. I get texts saying my ballot has been received, has been signature verified. You know, that just helps you be assured that your vote counts, because there's so much that that's being questioned right now, and so much misinformation about the absentee ballots. That would put a lot of that to rest. At least you know your ballot is going to count.
Yeah, I love that. I think the most powerful thing about what you just said is when we look at the idea that it's so important that we want to know that our ballot counted, we look back 4 years, 8 years, and these weren't things. We didn't get text messages letting us know that our ballot was received or that it's coming to us. And that is the power of voting. We voted someone into office who was able to foresee what disenfranchised communities are struggling with when it comes to the voting process. And he has really dismantled all types of opportunities that we had and given us a new access to voting that we've never had before. And now it's important that we continue to vote people like that into office. So I think what you just said is such a pillar in what we're doing as a community, because we are making the right choices in voting, and we're continuously putting people in the office that do serve us. And it's important in November that we continue to do that.
And Riel, and I just want to say, just a reminder that it may be kind of cliche or cheesy, but just a reminder of where we were just 60 years ago. You know, 60 years ago is not a long time ago. 75 years ago was not a long time ago. We did not always have this right. My mom, she's going to kill me, but she looks good. She is 75 years old. You know, they did not always have this right. You know, and the fact that we have people who will just willy-nilly say, oh, well, I don't like this, I don't like that, I'm not going to waste my time, or this is confusing, that's confusing, I don't want to waste this, I'm not going to do that. No, this is not the time to be complacent, people. This is not the year. This election is not the time to be chilling on the couch and be quarantining and comfy. This is not the time. There is too much at stake here. Like, the world literally is at stake. Yeah. Generations are at stake. And to just not want to, for whatever reason, to not want to be engaged at this point in time
Mhm.
is no excuse. There's no excuse whatsoever.
Yeah, completely unacceptable. I believe that the circle to the cipher, what we're doing right now, and having multi-generational conversations is what changes the game. If you don't know something about voting, if you don't know something about legislation, if you wondered about domestic violence, we have resources. Here at the Maricopa Branch NAACP, you have generational leadership. There are so many resources available to you. So I just want to also remind everyone how important it is to plug in to this branch of the NAACP. If I'm correct, this is the oldest and the strongest running branch here in Maricopa County, and it is so important if you are in the Black and Brown community and really just an ally of the Black and Brown community, that we tap into the resources that are accessible to us. So I'm so grateful for this panel. Rocky, what's the next question?
I did definitely want to reiterate that and reinforce that. It's very important to tap in. I appreciate those powerful words. We have one more question, be a pretty serious one. So this comes from an anonymous source, which asks, why aren't there rape crisis centers and what can we do to address this issue?
Great question. Fantastic question. So I think that might be a question for the state legislature.
Do you think if we had more women in this legislature, especially more women of color, that would get addressed? Because look at Arizona, we have one woman, one Black woman in the state legislature. And I think if women have a presence, then they can mount, a defense to having something like that. I think and just look at all those rape crisis kits that went untested.
Right.
I mean, that just shows what they feel about women's health care. It's not a high priority. We should be first and foremost when it comes to something like that, and protecting our young Black women.
The rape kit controversy is a national travesty. And so that is a state legislature issue across the country. There was we had that issue in Oklahoma as well. And so that is definitely, now, as far as it being no rape crisis centers in Arizona, that's definitely the legislature. As to why there's no rape crisis centers here, I have no idea. But that's a great question.
Yeah, when we look at the travesty of what we're addressing, especially to the Black and Brown communities, especially as women, we're looking at a voter issue. And so what I want to compel all of you that are here and that are listening to do is exactly what we keep addressing. We have to vote. We have to make sure that our Maricopa County attorney is someone who cares about making sure that those rape kits are tested and they're used in a prosecutorial system, right? We have to make sure that we're voting in someone who stands in solidarity with the Black and Brown communities when we say, hey, in these areas, we want more domestic violence centers. We have people on our ballot right now who have put this as part of their platform. In fact, there's women that are running that have placed it on the forefront of their platform. So I encourage you to do your research and make sure that we are voting for the senators, the legislators, the county attorneys, the council men and women, and even all the way down to school board. Because when we look at the school to prison pipeline, when we look at the way, Tamera said something so valuable that I don't want to overlook in this conversation. And she said, as a high school student, she was taking crisis calls and she was listening to these calls saying, why isn't anyone doing anything? What can we do? Who is calling in? As a high school student. So we have to even address school board, vote all the way down the ballot because it matters what's happening in our school systems all the way up to our senators and our congressional leaders. These are important people to vote for. And if you're confused about what each position does, that's why we have panels like this. Feel free to reach out and really do the research, but also make sure that that we vote. So Dr. Greene and Tamera, thank you so much for taking time to participate in tonight's event.
You're welcome.
Thank you. Thank you so much. This was great. Thank you so much.
Wonderful. You
That's
both have
very
really,
necessary conversation. Thank you.
absolutely. You both have very important roles in public health, and we appreciate the work that you're doing daily and the work that you're doing in our communities. Thank you for sharing your responses with the community, and it was a pleasure serving as your moderator for tonight's event.
Thank you.
Jacob.
Thank you both. I just wanted to give you both the opportunity to have your remarks after Brio was speaking. Again, thank you, Dr. Greene, and Tamera. That was very powerful. And thank everybody for tuning in today. We do have a special guest in the house once again, as you probably expected. We have Torrey Masters. It's spoken word, MC, lyricist. He's amazing. So as you already know, he did prepare something special for this evening. So I'm going to go ahead and turn it away to Torrey Masters. Let's get it.
Thank you for that, Rocky. Just want to be sure that I'm okay and that I will be. It seems like people and my food is trying to kill me. Injuries I can't pay for from chasing dreams I wasn't made for, and athlete because I'm Black. Thinking to myself about my grandpa's health. I don't have a magic wand, so how can I help? You add that migraine to that toothache and subtract health insurance, now emergencies have to wait. Trying to dodge a diabetes my grandparents sent for me. Every little pain is scary and I ask, is this it for me? Thinking to myself about health. I don't have a magic wand, so how can I help? Thank you.
Yo, I'm tired of you, Torrey, man. It's every time out of the park. You're very bonds with it. I'm not gassing him up or anything, as y'all already know. He brings it every single time.
Thank you.
Yeah, again, that was Torrey Masters, everybody. We are in such a pivotal moment in American history, and some of these issues that we discussed here tonight are front and center. So we wanted to circle back around one more time to both Dr. Greene and Tamera in the event that you had any closing remarks. Since we do have everyone's attention, we find it important that if you have anything extra in addition to say, that please let us know. Could we start with Dr. Greene?
I would just like to encourage people to get involved in politics here in Arizona. It's one thing that I have done since I stepped back from practicing medicine. It's very important that you become a precinct committee person. And also we have a Black engagement committee that I would love to have more young Black people engage with, because we've got a long way to go here in the state. When I first moved here 12 years ago, I was just surprised at the state of politics and some of the ridiculous legislation that I saw proposed. But we can't change it unless we get involved. And so I would just encourage people to run for something, run for office. There are people behind the scenes that would support you, but it's important. We cannot make a change if we stand back and criticize. You have to get in there and do the dirty work.
Thank you. Powerful. Absolutely. Well said. Tamera, do you have anything else to add in addition to this in order to close it out for tonight?
Yeah. Vote, y'all. Just vote.
Yeah.
Vote. And just like Dr. Greene said, get involved. Volunteer your time to something that matters to you, and just volunteer to help something, just to help your community, and vote to change. Just vote to change, and just be a part of change, be a part of something bigger than yourself.
Dr. Greene, how do we get involved in the Black Engagement Committee if we wanted to do that?
We actually have a Facebook page. So it's it's under Black Engagement Committee. You can post something on the page with your information and we'll get you keyed into it because our numbers are growing. I think we have about 120 people on our mailing list right now. And unfortunately, we were on a roll before the coronavirus hit and we were getting people engaged, plugged into the political process, but we still have Zoom meetings. We are going to get together shortly after this election cycle and just continue to bring people up to speed on what's going on in Maricopa County, because let's face it, 60% of the legislation or the voters in Arizona are in Maricopa County. So we do have the power. We just have to exercise it.
That's good. And Tamera, how do we get involved if we want to be involved in a crisis center or something related to domestic violence if we want to help those women?
Best way to get involved would be to check out what's going on with the coalition because they have a statewide presence. So check out what's going on with acesdv.org. That's acesdv.org.
Perfect. And that will be below in the chat, both the Black Engagement link and the ACES VD. So if anyone is interested, we'll place that in the chat. Thanks so much, Rocky.
Yes, of course. And once again, thank you everybody for taking the time to join us for a powerful discussion. It is important to do our part by getting out the vote. It's not just one of those times where we can sit idly by. We have to be very proactive in shaping a better future for those who come after us. So again, please do your part by voting. If you have any people who are cynical about the system, please help them understand all the things that can be changed by just simply voting and voting down ballot and voting with an educated perspective. So it's been a privilege serving as host for, the third time. So of course, in tradition, it's time for me to turn over the program to Maricopa County Branch NAACP's second Vice President and Political Action Committee Chair, Dr. Camilla Westenberg. It's been a pleasure serving as your MC. My name is Jacob Rayford. Some of you know me as Rocky Tirade, and have a wonderful night. We'll see you soon.
Good evening, everyone. I would like to get my thank yous out this evening first, and then provide some parting words. Rocky, as always, you held it down with facilitating the evening. Brielle Ritchie, thank you so very much. You did a spectacular job of moderating and keeping the flow going. Our special guests this evening, Dr. Judy Greene and Ms. Tamera Massad, thank you. The information that you have provided this evening has been absolutely incredible. I think that you have given the listeners insight into what some of the issues are and how profound they are. And once you understand that and you begin to get the big picture, then I think that's part of the key to moving into action. I would also like to thank the behind the scenes individuals, Ms. Kadisha Jackson and Mr. Patrick Brown, and our president, Dr. Karen Harden, who was receptive to embracing the idea of a Facebook Live. I want to tell you a little bit about Circle to the Cypher. This evening is the epitome of what Circle to the Cypher should be. When I began teaching my rap literature class, and after making several trips to Africa and correlating the two, the elements of hip hop culture and what is happening here, I looked at the circle when people would gather together in Africa to dialogue and to make decisions. And then I looked at my young people on the streets when they would have a cypher to talk about what was happening in the hood. And I realized that there was a great need for us to come together. You mentioned intergenerational. That's what it is supposed to be. Dr. Greene this evening mentioned how long ago, 30 some years, and you said, well, I'm just 30 something, intergenerational. And you mentioned your mother. This month, I'm 73 years old. You have individuals coming together, and what your mother said was true. The privileges that you are experiencing, that young people are experiencing today, were not the experiences that I experienced at your age. Completely different. And so I know for a fact what we are potentially looking at if we don't take matters into our hands. And it's my thought that it's going to be worse than it was even for me, if you look at how things have unfolded. And so I want to tell the listeners, please don't be complacent. You're going to have to become engaged. Teray knows, Rocky knows. I call them up and I talk to them. And I said, what are you all doing down there? You're marching, you're protesting, or you're registering people to vote. I'm sending them messages. I'm calling people and sending it to individuals saying, please, the marching is good. The activism is good. It makes you feel good inside. But the fact is, you are living within a system. And I go back to a film, Teray and Rocky, that IROC made about the system, that it was dealing with the police department. But tonight we're talking about the system as it relates to health. And as we talk about this system as it relates to health, it is a matter of Black Lives Matter too. It isn't just with the police department. You are talking about Black Lives Matter as it relates to health. And so those connections have to be made. And I would say to young people, because that's part of the intent, to wrap young people into, pull them on into the voting process, that you are living in the system and it is playing you. There are decisions that have been made and that locally and nationally, and you are being played. And if you don't get into the game, you're going to lose. Just keeping it real. If you don't get into the game and play, you're going to lose. And playing means that you have to participate in the voting process. Please, please, I implore you to vote. Make a plan, just as you would make a plan to go to your doctor. The trend now is to make a plan. Choose a day, a time, put it in your phone and schedule it. We have some information here regarding voting. The last day to request a ballot, and that has passed November 3rd. Well, the last day to request a mail-in ballot is October 3rd. The deadline to mail back your ballot is October 27th, and November 3rd is election day. Personally, I don't advocate putting your ballot in the mail. I think you should take it somewhere because we know that the US mail system has been compromised. And then, of course, you have some locations that you can go to get information, as you have heard, to track your ballot and to find out information about where locations are that you can go that are close to you with the hours. Take your phone out now and take a picture of that. And the voter protection hotline, if there's anything that's unscrupulous or you have any question that you need immediately, there are attorneys there that will help you with that immediately. So that 866, our vote, is the number for that. Beyond that, Dr. Martin Luther King said, and this was one of the quotes that I used for our Freedom Fund dinner. And I don't know, Patrick, if you had another slide, was that the only one that you had? I'm assuming it is. He said that there is an urgency in now. And I say to you, my younger sisters and brothers, there is an urgency. So take care of business, set an appointment with yourself, put it in your phone, get the date and the time, figure it out, and vote. I thank you so very much, everyone, for being here this evening. It has just been quite a pleasure. And I thank our guests and all of our participants. Have a wonderful evening and be healthy.
Mhm.